So today I saw a patient, a 65-year-old male with a past medical history of COPD and CHF. And I looked for his most recent sleep study done so many years ago, I would say maybe about 5 years ago, and he had a home sleep study, right? And I'm like, wait, why do you just have a home sleep study? Have you ever had a titration study before? And someone would say, why not? Why can't he have a home sleep study? Now, when people have COPD, they may also have lung damage that can put them at risk of severe hypoxemia, and this is independent of them having sleep apnea. So the recommendation should be to have a sleep study in the sleep lab where possibly we can make sure that they're getting enough oxygen. And that sleep study should also probably be done with the PAP machine, okay? The second thing about this patient is that patient had a history of CHF and congestive heart failure. And I'm like, wait, where is your echo? Who is your heart doctor? When was the most recent echo? And he said, I don't know. And I began digging, and I found that many years ago, maybe about 10 years ago, this patient had ejection fraction of 20%. And I'm like, wait, that's not right. And there has not been a repeat echo since then, right? So I'm like, wait, you need a new echo. What's going on? What are the doctors saying about your heart? And he's like, well, they said things are better. Now, I don't know. Maybe he's been offered an echo and he said no and all of that. But the point of this the point of my talk or my message today is that when a patient has CHF, he's at risk of a type of sleep apnea called central sleep apnea. And a home sleep study is not the best study for this kind of patient. Now, he doesn't just have CHF, he also has COPD. So this is a classic patient for an in-lab study with a titration on top of that, okay? So this is good for providers to know that some people order sleep studies for their patients. So when you have this kind of a patient, they need to have a sleep study in the sleep lab. And I know that sometimes insurance makes it hard for us to get the type of sleep study that a patient needs. But just knowing at least that the first or a study to order is an in-lab study where we can look at their oxygen levels, we can make sure that they get on PAP and make sure that they're on the right pressure that can optimize their oxygen is really what one should do.